What's going on, YouTube? Caden here. I am 1 week away from my top surgery, 7 days. I fly down to Florida in 5 days to go meet Dr. Garramone. So I just wanted to make a video on kind of what my process was in scheduling that surgery and preparing for it and what I'm doing to prepare for my recovery. I just want to put a disclaimer here. This is the process that I went through with Dr. Garramone. And my own process. This is certainly not going to be comprehensive for any guy looking to get top surgery, especially if you're looking to go with a different surgeon. This could be a very different process. I scheduled my surgery back in July when I was about 4 months on T, and I scheduled it, I think it was the same day that I did my consult over the phone with Dr. Garramone, but I could be wrong. I might have called back and scheduled it a week later. But the way I kind of got started was, like I said, I was about 4 months on T, so I was starting to kind of consider what I was going to be doing, because I know that the process is very long, and there's a lot that goes into preparing for it. So I wanted to have it kind of scheduled further out. But so the first thing I did was I kind of got to researching surgeons on my own without contacting any of them. Just kind of seeing results on social media and talking to people who have gotten surgery and watching videos on YouTube of chest reveals. One of the most important things when looking for a surgeon is to look for somebody that A, does your kind of surgery, which I'm going to talk about in a second, and B, the people that they operate on have a similar physique to you, or a physique that you're going towards, because that's what's ultimately going to give you the most satisfaction with your result, is if you're going with a surgeon that's used to operating on your body type. The other thing that's important to consider is what kind of surgery you're going to have. There's three main types of top surgery that you can have. The most common is probably the double incision bilateral mastectomy, which is what I'm having. This is pretty much the only option for any guy that's has like is larger chested. And pre-T I was a double D, so I really didn't have any other option other than bilateral. But so basically that's when they make 2 incisions like right underneath your chest, and they lipo everything else out. They cut your nipples off, and once they're done with everything, they reattach them as a nipple graft. So that's what I'm having. It's the most invasive one. It takes the longest to recover from, but that's what Dr. Garramone specializes in, so I'm really excited about that. The other 2 types that you can consider if you're smaller would be periareolar or keyhole, and those both involve no incision underneath, but an incision like around the nipple or like in underneath it, where they just lipo out that way, and then just kind of your chest kind of contours itself that way. So those are really the options, but I'm like I said, going to be having double incision. I settled on Dr. Garramone down in Florida just based on his former patients. I felt that he had the most consistent results that I wanted. And so this was it was a very personal decision. That's going to be a personal decision for anybody. Anyone is going to choose the surgeon that they feel most comfortable with. And Garramone was my guy. So that was it. I chose him, and I knew that meant I would be flying down to Florida for my surgery. So I was okay with that. Even though I hate flying, I'm getting really nervous, but that's all right. It's going to be worth it. But so this, like I said, this was back in July. I sent an email to Dr. Garramone's office, just found it on his website, and requested a consultation with him. And if you're out of state, he does his consults over the phone. So they emailed me back. I think it was like within 48 hours. They got back to me really quick and said, okay, can you do this day and send photos. They give you his personal email address. And if you're not willing to send photos to that personal email address, you can't really have the consult. So I took photos just with my webcam, just like this, of my chest from the front and from both sides. So just kind of like standing like this. And emailed him those 3 photos, and he got back to me saying he would be interested in doing a consult with me. He doesn't do them with every single patient that requests one. So he accepted my consult, and I think it was about a week later I was on the phone with him, and he asks you a bunch of questions. It's very, very scripted. I'm going to be honest, and people do say that about Dr. Garramone, that they say he's robotic, and they say when you watch his YouTube reveals how he says the exact same thing at the exact same time to every single patient. Yes, I have noticed that, and I am ready for that because I'm not paying him to be my friend. I'm paying him to be my surgeon and do this right. So if he wants to go through the exact same thing that he does with every single other guy, then that's the way I want it done. Because everyone else's results that I've seen him do are outstanding. Dr. Garramone does not require you to be on testosterone to have top surgery with him. He does operate on non-binary patients. So they offered me to do my surgery in September when this was in July. My personal decision to move it to January was that in September I was only going to be about 6 months on T, 6 or 7 months on T. And I really wanted my pectoral development to come into play. And so right now I'm about a week away from being 10 months on T, and that I thought 10 months was going to be a good amount of time for me to be able to get my muscle where it was, for my body fat to redistribute and things like that. And I am pretty happy with that decision and where it's brought me so far. That's one thing to consider, is when you want to have your surgery in relation to other things going on in your life. And just keep in mind that the recovery is quite long. And then he basically was like, all right, it was like a 5 to 10 minute conversation, not very long. And he was like, all right, I'm going to send you through to my scheduling department. You can place your deposit and book your surgery whenever you want. So basically he gives you the okay on the phone, and then you can either schedule it right then, or whenever you have the deposit, which is $500, you can call them back and schedule it. So I was ready to schedule it. I put my $500 deposit down. The staff was really nice. They congratulate you, and you put your deposit down, and it's really exciting to have that kind of solidified moment, I guess. The way that the pay structure works, Garramone's surgery costs $7,800 in total, and he does not accept any insurances up front. So if you're using insurance, that's something that you want to address while you're looking for your surgeon, because a lot of surgeons, especially a lot of the top surgeons, do not accept insurance information in advance. You have to go through the surgery first and then submit their stuff to your insurance to see if it will be covered, which is what I'll be doing. Garramone gives a letter after the surgery that you can give to your insurance to see if they'll cover it. But basically everything's coming out of pocket. So I put the deposit down back in July, and then I didn't have anything else due until December, which was 30 days before the surgery date. At that point, the rest of your surgeon fee is due. The surgeon fee is $6,500. That goes directly to Dr. Garramone, but $500 of that is part of the deposit. So I had a $6,000 balance remaining in December, and then the outstanding $1,300 is actually going to be due on my date of surgery to the hospital. It's the anesthesia and all that, the fees for the hospital. So I'll bring that with me when I go there. So that's the financial aspect of it. My insurance doesn't even know I'm undergoing surgery at this point. So that's the way that goes. Some things to keep in mind when you're scheduling your surgery. So keep in mind what your ideal physique is going to look like, because that's going to affect whether or not, if you're on testosterone or not, when you're going to have your surgery. Because for me, I wanted my muscle to develop more. I wanted my fat to redistribute more before I went and tried to prepare for a recovery that long. So definitely keep in mind that. Keep in mind the time of year. I'm having my surgery done in January, so for the summer, I'm going to be all recovered. So that was one thing. I did want to have my first shirtless summer in 2017. So January was a good time for that. And also keep in mind that the recovery is about 6 weeks long. You're going to have to take time off of work or school or whatever it is that you do. So just make sure that that's copacetic in your life, that you are able to take that time off. Also, just kind of where you're at with your support system in general in your life is going to be really important. I actually went ahead and booked all these things without my family really involved, but that's just because at the beginning of my transition, they weren't really a huge involvement in my life, and I had scheduled my T consult and everything without their involvement. And so this was really something that I really decided to do on my own, went through on my own, but then brought them into the process afterwards so that it wouldn't be influenced. I really wanted it to be 100% the way that I wanted it to go. And so that's the way it's going right now, and I'm really excited about that. But I do live by myself, so when I get home from Florida, that is one thing that I'm concerned about, is my recovery alone. You know, it's just me and my dog. I have a dog to take care of. I'm taking time off of work. I pay rent myself. I'm responsible for all my utilities. So a lot of that decision, depending on your situation, you're going to have to really be on top of, can I afford to take this time off? Can I recover by myself? Can I handle that kind of stress mentally and physically? All those things are really important to keep in mind. Other than that, I'm super excited to go. I'm very, very nervous. Like I said, mostly just because of flying, mostly because of leaving my dog for 10 days. We've never been apart for 10 days. I know that sounds goofy. The surgery itself, I'm not super nervous for. It's more those other things I just mentioned, and the recovery time, taking my time out of the gym and things like that I've really come to rely on in my life for stability and just mental health and things like that. So it's gonna be weird, kind of finding a new normal for a couple weeks, but I'm ready to go, and I think it's gonna be awesome. And I guess next time I see you guys, I'll probably be post-op. So here we go.